Hey guys, it's Dr. Justin Marcagiani here. Today's video is going to be about testosterone resistance, ways that your testosterone can actually drop from taking testosterone. So one of the first things I see people, conventional medical doctors, prescribing testosterone like it's a supplement, right? They're using hormones like it's a supplement and they're actually giving too much of it. And I'm seeing high levels of testosterone. Now, a couple of things that does is all hormones function and dysfunction together. So when you start to give too much of a hormone, so if we have our reference range, let's say testosterone is 300 to 1,000, right? Let's say the sweet spots, the middle is like 5 to 700, upper 25%, 800, 900. If you start going over 1,000, you're going to start to have some down regulation in the receptor sites. The receptor sites start becoming more numb to the testosterone. This is called receptor site down regulation, right? We see this in insulin resistance with too much carbohydrate. We also see this with too much testosterone. So receptor sites can actually down-regulate in regards to our hormones. So even though you're taking a lot of something, it's like not a lot of it's there because the receptor sites tune down the volume. All right, so really, really, really important. It's like watching an action movie and the volume is set really low. Even though there's a really loud scene, you can't really see it or take it in. Before we dive in, though, make sure you smash that like button, thumbs up, put your comments down below. Let me know about your experience with testosterone as well. It really helps. And make sure you share with family and friends. All right, let's dive in a little deeper. So one of the first issues with high levels of testosterone is just taking too much. So if you're going to take testosterone, make sure you're taking it within the physiological range. So make sure your testosterone levels don't go above the high end, and ideally stay in that top half, the top quarter of the reference range for free as well as total. Now, when you take too much testosterone, you may see things like sex hormone binding globulin increase. Now, that's a binding protein that's trying to bind up testosterone, and when it binds it up, it's trying to decrease its ability to bind to a receptor site. So hormones have to bind to a receptor site to work. So if here's the receptor site, here's the hormone, it's supposed to dock in. If there's a protein here, it can't dock. So you'll see sex hormone binding globulin increase. You may even see estradiol increase. Now, estrogen, if testosterone gets too high, we can see testosterone go downstream to estrogen. Why is this bad? Because estrogen is the counteractive hormone, right? Testosterone is the male hormone. It's going to have libido. It's going to have muscle mass. It's going to have that kind of male aggression kind of to it. Estrogen's going to have more of the female quality to it emotionally. It's going to have more fat gain on there as well. And that's not good if you're a guy, right? That's counterintuitive, right? Men should have about 10 times more testosterone than estrogen, and vice versa for women, about 10 times more estrogen than testosterone. So there's kind of a flip there. If we get too much, it's not going to be good for kind of your natural energy. For men, it'll help with muscle. It'll increase muscle loss and fat gain. And for women, too much androgen is not good either. You can see Pcos, polycystic ovarian syndrome. You can see excessive coarser hair around the lips and the face, and you can even see increased acne. So both sexes, if you start to mix up the hormones there, you can definitely have side effects. So first off, we're going to see increased sex hormone binding globulin. We're going to have receptor site down regulation. So you could have low testosterone symptoms, hair loss, especially on the legs, lower libido, lower energy, lower muscle loss, memory, cognitive issues, low motivation. You could have that with high levels of testosterone because the receptor sites are down regulating. It's very possible. Second thing is we're going to see increased sex hormone binding globulin. We're also going to see an increase in estradiol. So hormones are going downstream. We're going to have more female hormone-like symptoms, right? Muscle loss, fat gain, more moody, more emotional. Hormones can cause that. Women, you may see increase in libido. You may see an increase in aggression. You may see an increase in acne with the higher levels of androgens. And then, of course, high levels of estrogen on men actually decrease the HPG axis, hypothalamus pituitary gonadal axis. So when you have high levels of estrogen, there's a GnRH hormone from the pituitary, and that signals the testicles, or that signals the pituitary to make LH. So it goes hypothalamus GnRH, pituitary LH, LH goes to the testicles, testicles make testosterone. When we have high levels of estrogen, that decreases GnRH, that decreases LH, and then we have less signal to the testicles to make testosterone. Now, this is a big deal because this can definitely affect the upstream signaling. So high levels of estrogen not only decrease the upstream signal, but you're going to have less testosterone because you're not making it now. And so if you take too much testosterone, now you have receptor site downregulation, and then you have the upstream signaling decrease as well. So it hurts you on two sides of the fence there. So really important, right? We want to look at estrogen, and that's called aromatization. The enzymes for testosterone go downstream to estrogen. That's called aromatization. So things that we would do to prevent that is, one, keep insulin down. Two, keep testosterone, if you're going to take it, keep it down to within the reference range. My feedback is work on the adrenals first. Use pregnenolone, use DHEA, use natural adrenal herbs. Work on what you have before you go into a hormonal support program, like meaning you're actually giving replacement hormones for the end stage hormones. Number two, make sure selenium, zinc, magnesium, these are really important cofactors to make testosterone. Make sure you're consuming enough protein, enough amino acids. If you have poor digestion, you could have low stomach acid, you could have a gut infection, so make sure you're digesting your proteins and your fats and your cholesterol well. I would say after that, make sure you're engaging in some kind of resistance training. It's really important, super slow training, some kind of a really good resistance or interval or burst, that you're using really good compound movements, multi-joint movements at an 8 to 12 rep level. Healthy muscle mass and muscle stimulation will help with growth hormone, and that will help with testosterone. So it's one of the best ways to actually stimulate testosterone. And don't overdo the carbohydrates and insulin. That's, like I mentioned earlier, that's going to help significantly in regards to aromatization. High levels of insulin can definitely increase aromatization. And if you're going to engage in testosterone, right, try to do all the other functional medicine things first. And if you do it, try to keep it within that reference range. This is Dr. J here. Hope you guys enjoyed this. If you have any hormone issues, you're a guy and you want to dive in deeper, or a female too, right, on the hormone side, feel free to reach down below to myself and my colleagues. I see patients like this all the time, every day, from all over the world. And if you want to put your comments below, let me know what you think. Let me know your experience on the topic. And if you have any questions, also, please feel free and let me know. And if you enjoy the content, make sure you subscribe, hit the thumbs up, and smash that bell so you get notifications of great content coming your way. All right, let's see if we have any questions here. Vitamin D can also be a big thing as well. It can definitely help with hormones too. So vitamin D is really important as well, definitely on the immune system side. Can oxy powder disturb good gut bacteria? If you take it too much and your stools are overly loose because you're just having, increased bowel movements because you're taking it too much, it's always possible. So if you're taking oxy powder and you're doing it because of a constipation, just take the lowest amount possible to keep your bowels moving. Can you order your own test to determine if you're dealing with PCOS? I mean, you could look at a fasting insulin and you can look at a free and total testosterone. That's a pretty good option outside of a transvaginal ultrasound from your OB. What type of food do you recommend or think could increase testosterone? So good proteins, right? Because amino acids are really important building blocks. You have hormones that are peptide-based, right? And then you have steroid-based hormones that are made from cholesterol. So amino acids and good cholesterol are going to be very important. Egg yolks and keeping your carbohydrates in check. And then, of course, the good stimulation, the good resistance training, compound movements. You can do super slow movements too. So if you do like a push-up, it's a fast concentric and a very, very slow, maybe a 4 or 5 second eccentric. Things like that are great because you're not going to hurt yourself as much because you're more in control. But two, the time under tension for your muscles is really high. I'm a woman with increased SHGB, way too high testosterone. My ND put me on estrogen patch that balanced out and lowered the testosterone. My hair loss is terrible. So I typically, if you're a cycling woman, I would never want to put you on unopposed estrogen. It's one thing if you're menopausal. If your testosterone's too high, it's the same issue, right? In women, when testosterone goes too high, it's because of the 1720 lyase enzyme. Insulin and inflammation will definitely take estrogen with women, and it will increase testosterone. And estrogen, most women are estrogen dominant. So if you're going to give anything unopposed, it should be progesterone, but it just depends where you're at hormonally. Are you cycling? Are you perimenopausal? Are you menopausal? All that matters, but I typically never give women estrogen unopposed. I've been keto for 3 months. I can fall asleep easy, but wake up too early, 4 a.m. to 5 a.m. Any supplements to help with sleep quality or sleeping longer? Don't know what time you're going to bed at. Could be a blood sugar issue. I'd look at making sure blood sugar is good before you go to sleep. If a Barrett's esophagus-like situation is possible for a chronic cough, would you recommend doing nutrition and supplement-wise already on low carb? I mean, I would go look at your gut first and see if there's any gut issues or infections, and I'd make sure your diet's as clean as it can be, and try even pre-digesting the food with a crock pot or an Instapot. Okay, started taking wormwood to possibly clear some things out. Parasites, started pooping a lot, no diarrhea. Hard to say. Not good or bad. All right, guys, any other questions, feel free and let me know. But in regards to testosterone, right, good stimulation with movements, proteins, fats, cholesterol, magnesium, zinc, selenium. Make sure you don't overdo it. If you are taking it, work on adrenals first. Very important. Try to be within the reference range. If you take too much, you're going to increase your female hormones. That can affect upstream brain signaling and decrease LH and decrease your own internal production. Favorite herbs for testosterone, you can do things like tribulus, horny goatweed, tongkat ali, eleuthero is excellent. These are all some good herbs that are very helpful at kind of modulating some of these things. You can do some glandular tissue as well, orchic glandular, all very, very helpful. All right, guys, it's Dr. J here. If you enjoy the content, comments below, share with friends or family, and make sure you give me a thumbs up. Really appreciate it. You guys have a phenomenal day. Take care, y'all. Bye now.